do know for a fact that if a man has a neck size over 17 and a woman has a neck size over 16, or if a man has a waist over 40 inches and a woman has a waist over 36, or if a man's BMI is over 30, they're at a 90% higher risk of getting obstructive sleep apnea. We know that postmenopausal women are at higher risk due to the fact that they get more fat pads in the lateral sides of their pharynx. And so the studies have demonstrated that people who are heavier are going to be at a higher risk. And we do know, you only need to look at the epidemiology of this country. The weight gain that's happened in this country in the past 30, 40 years is almost staggering. I think that somebody told me once you gain an average of a pound a year after high school. So if you're 40 years, you're about 40 pounds heavy. So I don't know if that holds true or not, but the fact that heavy people are at higher risk is absolutely true. But that's not entirely all that are at risk. We just discussed the fact that some children with large adenoids and tonsils are at risk of sleep disorder breathing. We know that people with a severe retrognathic mandible or a real severe underbite will be at risk of obstructive sleep apnea. And then there are some people that are just as lean and thin as can be that have obstructive sleep apnea. They present with excessive daytime tiredness, and the physician will order an in-lab sleep study to diagnose the issue. That's another issue that we need to talk about, is the fact that this has to be diagnosed by a physician, cannot be diagnosed by a dentist. If a patient presents to my practice and does not have a current in-lab sleep study, then I refer them back to the physician for an in-lab sleep study. They have to have been diagnosed by the physician before they can enter the practice. But the good physicians will recognize some of these signs. They'll refer their patients for a sleep study. Sleep studies will either confirm or not confirm the fact that they have sleep disordered breathing, and then we take it from there.